Children bring a warmth and happiness to the things they touch. And at Pediatric Health Choice, we are dedicated to helping children reach the full potential of their lives. As a leader in quality health care for infants, toddlers, and children living with medically complex needs, we offer solutions for cost savings and quality care to families, physicians, and third-party payers.
Okay, push Tony.
The challenge of caring for these precious lives is our mission, and these solutions are found by putting all the pieces together.
We've been getting this treatment for about 2.5 years.
Very big boy.
First we were getting it at the hospital, and that took all day. It wasn't as comfortable as coming here. Here they have everything. And so he's become more comfortable too with his infusions. Now he knows it. He knows his IgG. That's what they call it. And he didn't even cry today. He's been getting better at it. Before it was horrible.
Okay, let's put this side of that in. There.
Every 21 days, Carlos gets his gamma globulin infusion at this day health center of Pediatric Health Choice in Tampa, Florida. This infusion is an example of our pharmacy, medical equipment, and skilled nursing services working collaboratively to meet the complex needs of medically challenged children.
We care for a variety of children with several different types of medical needs. Not only are they long-term chronic needs, but some can be acute in nature. With Pediatric Health Choice being able to provide an array of ancillary services, we are a cost-effective measure in that one physician, one payer source, one family can call us for a one multi-vendor service.
From a medical standpoint, they're one phone call away, and you can address basically all of their needs outside of the hospital, from complicated pharmaceutical needs to nursing care to home health care, special equipment, and supplies. They're all provided under one umbrella. It cuts down on the forms that you have to fill out. People know who you are. You only speak with one person.
This kind of management from both medical and psychosocial has brought down our hospitalization rates a tremendous amount. The average daily census for our medically compromised kids is about 1 for our whole patient population per day, and sometimes less than that. We can go weeks and not have a hospital admission, and yet we're using IV antibiotics, inhaled medications, 24-hour infusions, TPN, and it's all being handled outside the hospital.
Don't you laugh. The reason I feel that they are not had in hospitalization overnight since they have been a patient of ours is because they get, Monday through Friday, they get their daily nursing care, as well as their aerosol treatments and also preventative. We listen to their lungs every day, and if there's the slightest bit of change, we call the physician, and therefore he can call a medication in for mom versus an office visit or an ER visit.
We knew that the information we were getting was valid, and so it was very helpful from that point of view, and also to tell if the child's getting better. We could take the feedback we got from the center and help to decide whether the changes we were making were useful or not. So it provides a level of medical supervision and surveillance that you could get with one-on-one nursing at home, but you would then lose the socialization for the child.
Pediatric Health Choice recognizes the child and the family as a cohesive, multifaceted unit. And so it supports families in becoming independent caregivers.
Teaching is an ongoing phase here. It is our nurses' goal to find out where that parent's understanding and education level is so that we can reteach or add to what they already know. So we train them so that they can be the best caretakers for their child.
The kind of patients that we follow are very complex, and a facility like this is actually a bridge between the hospital and the home.
When the children are here, I know that they're getting their medication, I know that they're getting their therapies, and when they're at home, there's no way that we can ensure that that's occurring. And if they're getting their medication or getting their treatments, they will get better quicker and they will stay out of the hospital, which is our goal.
Now remember, it's going to be a little different first, okay?
Our family-centered approach offers a bundle of medically necessary services, which are coordinated efficiently through one single point of contact. This system facilitates communication and efficient utilization, leading to improved outcomes. This comprehensive approach supports family independence and optimal levels of health, growth, and development for each child.
Good morning.
Hey, how you doing?
Great.
Hi, buddy.
I mean, that's what made this place so great, is that from the very beginning, they provided, first of all, 24-hour nurses, so literally they trained us on how to take care of them from the beginning, and I think that went on for a couple weeks, and then they backed it off to like one shift a day, one 8-hour shift a day, and then once we were comfortable with that, it became, then he was a little bit more self-sufficient. It was, I think, when we started bringing him in here.
Yeah, put it on. See if you can put it
In addition to nursing professionals, Pediatric Health Choice employs licensed physical and occupational therapists, speech and language pathologists, and early childhood educators in order to provide a multidisciplinary plan of care.
Some of the children respond real well to handling and other ones do not, and so some of the therapy sessions the therapists need to be very flexible, and they need to be able to see when a therapy session is not working and adjust their therapy session.
Good girls, get it done. Walking big and tall.
Carly was not amiable to standing just a couple months ago. She did not want to put weight on her feet. She's now able to bring her heels down. She's asking to stand. She's excited to stand. So what the nurses do is after we set up the equipment, the nurses then will follow through with some of our program planning for the children.
These children are offered social opportunities and typical experiences, which help them attain their developmental milestones.
The educational assessments, academic assessments of these children are done mainly through the therapist, the OT, PT, and speech therapist, and myself. They're done in isolation or in collaboration with each other, working together on specific tasks, saying this is what I'm looking at. Have you seen it?
He's getting more proficient at sign language. His developmental progress has been attributed to his participation here at the center. He gets a lot of individualized attention.
Matt is walking for the first time without any assistance from a push toy or the ball. He sees the other children doing it, and he also wants to do it himself.
Pediatric Health Choice accepts its responsibility to control the burgeoning cost of health care. This is done successfully by linking families, physicians, and payers, and by offering an array of prescribed services.
The ways in which they can prove cost-effective, because I think they're clinically effective regardless of the cost, is by allowing healthcare givers to feel safe about sending kids home from the hospital sooner because of the knowledge that there will be good follow-up of their medical problems.
From the third-party payer standpoint, what this allows them to do is to establish a relationship with an organization that is multidisciplinary in nature and provides very comprehensive and varied services to their patients.
And little by little, they'll actually are getting rid of all these gadgets attached to them. And it's nice to see them actually get out of here at some point. And it's nice to see parents actually learning and seeing their children improve and get better.
He loves being here. He hugs everybody. Sometimes when I pick him up, we have to go through all the nurses where he has to hug each one of them individually before we can even get out of the door.
Oh, pictures, yes, yes, he's taking pictures. Is that exciting? Yes, it's nice.